Hello everyone, this is our dental talk without secrets, and today we're going to be talking about black triangle, black spaces, okay? Black triangles is this space here that you can find within the gingival embrasure when the distance between the contact point of two adjacent teeth and the bone crest is larger than 4 or 5 millimeters. Okay? If you have a large distance like this one here between the bone crest and the contact point of those two teeth, the papilla won't be able to fill in this space. Therefore, you're going to have a black triangle, a black space in this area. Okay, in order for you to avoid that, you would need to bring the contact point closer to the bone crest. If you keep the distance within 4-5 millimeter range, okay, then you find that the papilla will be able to fill in that space like this here. Okay, why do those black triangles happen? Well, the decrease of interproximal bone height can happen because of periodontal disease, periodontal surgery, or trauma. You can also find that excessive embrasure space, that excessive embrasure space in the gingival area by root angulation, especially after orthodontic repositioning, after orthodontic treatment. We find that this is a very common situation. After orthodontic treatment, we find patients with a lot of, sometimes many, black spaces, black triangles, okay? And there are other factors such as age, patient's habits, and genetics. There are some functional issues regarding those black triangles, which is the retention of food debris and or biofilm and calculus accumulation, which has a potential for tissue inflammation. You can also find some situations where lateral compaction of food debris, which might create uncomfortable wedging pressure between tightly spaced roots. Especially, you can find that between canine and premolar in the upper jaw. And there are also phonetic issues such as escape of air and or saliva during speech, which is very uncomfortable, okay? You can also find the narrowing of roots because of repeated scaling in order to remove the calculus that accumulates in this space, okay? You find many times situations like this one here. You see how narrow the cervical area of these teeth here are. And of course, there are the aesthetic issues. This paper here from the United Kingdom ranked black triangles as the third most disliked aesthetic problems regarding teeth, only above crowded teeth and dark teeth. So the only thing worse for that in that paper that they found out, worse than crowded teeth and dark teeth, is black triangles. So people really don't like them. And of course, in some situations we have large black triangles, like this one here, but sometimes we have very small ones, like these ones here. And even in those small black triangles, patients don't like them. Sometimes patients really want them to close. They feel like they have like a caries in that area. They find that very disgusting, really. But in those very small spaces, like this one here, or even these ones here, this is not the big one, the little one over here. So sometimes to do that with the armamentarium, with the tools that we have in our everyday practice, it's very hard. Sometimes we feel like saying to the patient, forget about that. Don't leave it. Don't bother with that. But patients don't like it. They want those spaces closer. They don't like black triangles. Okay. And this is, as I said, I think one of the trickiest thing to do in restorative dentistry. I have a big friend, a good friend, David Clark. I've known him for more than 20 years. And David has a company in the United States which is called Bioclear. And he invented different types of matrices to solve different situations, challenging situations that we have in our everyday practice. And one of them is are matrices to be used in those black triangles situations. Okay, so these matrices are called the black triangle matrix, okay? The BT black triangle matrix, okay? And they come in large sizes and small. You have the large group for upper jaw and the small ones for the lower jaw. Sometimes you use the small ones also for small upper laterals, okay? And each one of them, the large and the small, has 4 sizes which are color coded. You also have a probe where you can a probe that you can insert inside that black triangle, and depending on how much that probe penetrates inside that space, you will find which matrix you should use. Okay, so if it gets into only the red portion of the probe, you use the red matrix. If it goes all the way to the green part of the probe, then you use the green matrix. Very easy. Okay, it's very easy to figure out which one to use. So large ones for the upper jaw, small ones for the lower jaw, and depending on how much that probe penetrates inside the black triangle, you choose which one of those sizes you're going to wear. Okay, you're going to use, I mean. And those matrices, they are supposed to be used with a technique that is called injection molding. This technique, injection molding, to use that, in order for you to be to use this technique, you're going to need warmed composites, 3M materials, and a specific placement protocol. Okay, why 3M materials? First, because you need a composite that has a body shade. What is a body shade? It's a shade that it's between the translucent enamel shade composites and the opaque dentin composites. So those body shades are those composites to be used in only one increment. It's not supposed to, you usually don't use those body shades for layering composites, okay? So those body shades, they are not dentin shades and they are not enamel shades. They have an opacity, translucency in between opaque dentin composites and translucent enamel composites. So those materials, they're very interesting to be used in this specific situation. And 3M has the body shades from the Filtek Supreme Ultra, okay? And they also have the Filtek Universal restorative material. The Filtek Universal is it's a simplified shade composite. You don't have, in this Filtek Universal, you don't have the dentin and enamel. You only have one shade, one type of opacity of composite, and you have a simplified range of shades. You don't have all the shades from the Vita Shade Guide. You have just 8 shades that will cover all the shades of the Vita Shade Guides plus the 3 bleaching shades. Okay, and you can also, as I said, use the body shade from the Supreme Ultra. Of course, you will need either one of those to be in the Compule format. Okay, you can't use those composites in syringes. It has to be in Compute, warmed composites. And you can use the Supreme Flowable, which matches these 2 composites here, okay, and a good universal adhesive, such as Scotch Bond Universal and Scotch Bond Universal Plus. Okay, sometimes some places the old universal composite is called Single Bond Universal. Okay, but either one of those works fine in this technique. And then you have the placement protocol. The placement protocol is to etch the surface of the tooth inside the matrix, okay, for 15 seconds. You rinse and dry, and then you apply the Scotch Bond Universal adhesive. You scrub it, you air thin it very thoroughly, you don't cure it, and then you inject the Supreme Flowable, the heated Supreme Flowable, and again, you don't cure it, and then you're going to inject the restorative composite, the warmed restorative composite, okay? So the purpose is to do something similar to what we do when we take an impression with with a with a more heavy material and then a light material. Okay, it's somewhat the same idea. You start placing, the less viscous material, and then first you use, of course, the adhesive, and then you use a flowable, which is a very light, with a low viscosity material, so it can penetrate very thoroughly all the way inside the area inside the matrix. And then after that, you don't polymerize the flowable, and then you inject the Supreme Ultra or the Supreme Universal, the Filtek Universal, a warmed composite. You inject over the flowable inside the matrix, and that will remove most of the flowable. Okay, most of the flowable will be removed, but then you won't have any bubble, and the composite will be perfectly placed inside the matrix, all in contact with the tooth. Okay, after doing that, you adapt the resin, remove excess, and cure. Okay, 10-20 seconds each side, occlusal, buccal, and lingual. Okay, so this is the injection molding technique. Okay, I like very much this product here. Okay, the Filtek Universal. As I said before, it has 8 shades plus an XW, which is an extra white shade that covers all the 19 Vita Classical and Bleach shades. Okay, it's a simplified shade selection. It's a 100% nano-filled composite. It has a high strength and excellent wear resistance, and it polishes quickly to a high gloss that lasts over time. Okay, as I said before, it's a universal opacity which blends, and also it blends more naturally to the tooth, a little bit more naturally than the Filtek Supreme. Okay, here you have the body A2 from Filtek Supreme, and here the universal A2. You can see that both of them has the same kind of opacity. Okay, and here you can compare the universal with the enamel. You can see that it is much more opaque than the enamel shade of the Filtek Supreme. Okay, and of course, all those, either the Filtek Supreme and Filtek Universal, both materials can be warmed very safely. Okay, it's very safe to warm them up to 70 degrees centigrade for 1 hour. Okay, when you do that, the reduction of the extrusion force when you use your syringe is 75 to 80%. Many people ask, do we really need to warm the composite? If you use the Filtek Supreme, okay, the body shade, you need to warm that up because it's very viscous. The Filtek Supreme, sometimes in the around the world they call Filtek Z350, like in Brazil and some places in Asia, they call Z350. So if you use the Z350, which is also the same name for the Supreme, okay, that one must be heated. Otherwise, you're going to need an excessive force to put that composite inside the matrix. But if you use the universal restorative material, okay, this one that you see here in the picture, that material, that composite has a more creamy texture. It's easier, so you can even use that without heating. Okay, it's easier if you heat it, but you can use the universal composite without heat, and it will be fine. Okay, you just need a little bit of more force. But the Filtek Supreme, Filtek Z350, you can't use it. Okay, you need to warm up. You need to warm the composite. So let's see this case here. Okay, first thing that we do, we need to clean the teeth. Oh no, I mean, you need to clean the teeth, and before using your rubber dam, before using your rubber dam, this is very important, okay? You do your probing. You see that this large embrasure here goes all the way to the blue section of the probe. So I'm going to need the largest of the small matrices, okay? But then I have a very small space here, very small, that I'm not going to close because that doesn't bother the patient. Even this other side of the tooth here don't bother the patient. But I know that after I close this here, she will be she will complain about this other part here. So in the middle embrasure, it goes all the way to the blue, and you're gonna see here that in the small one on the side, it's only on the red. Okay? So once again, it's important to probe before using the rubber dam, okay? Because when you use the rubber dam, you will flatten the papilla and the space will be larger. And then you might have a result where the papilla will be too compressed. So probe first. Then clean thoroughly. You have to clean very well your tooth, okay? With everything you can, okay? Everything you can, okay? So once teeth are clean, in this case here, I'm also going to increase a little bit of the incisal edge of those two center incisors, okay? And to use the rubber dam is very simple in this situation. You don't need an amarillo or something like that. You don't need to use the dental floss to pull down the rubber dam. You don't need anything like that, okay? You don't need a knot, because when you place the matrices will dislodge, the matrices will move away the gingiva and, of course, the rubber dam and the gingiva. So you don't need to place a rubber dam. You don't need anything too tricky to use the rubber dam. And I think you should use it, because even if you have some difficulties in using the rubber dam, this is the easiest situation to use it. And because we're gonna work below the gingival level, okay, because the matrix is going to go inside the sulcus, inside the gingiva, we don't want blood, we don't want, of course, saliva, and we don't want the fluid that comes from the gingival sulcus, okay? So we don't want any type of contaminant inside our matrices. So it's best, believe me, if you use a rubber dam. And it's very easy to use it, okay? So once again, don't try to use a knot with a dental floss or something to pull down the rubber dam. Don't do that. You don't need it, okay? It's more simple. So I'm cleaning, I'm preparing it. So here is what I'm gonna do. I'm gonna use one blue matrix here, another one here, and a red one here. I'm not going to use it in both sides, because the size of my lateral, the lateral incisor here, is about the same size of the lateral incisor of the other side, okay? The right lateral incisor and the left lateral incisor, they are pretty much the same size. What I need here is to increase a little bit of the size of my central in the distal area here, so that this this triangle here, this embrasure here, will be the same size as this one. Okay? This is my planning. Another thing, I'm gonna do this side first, and then the other central, I'm going to do both sides at the same time. This is very important. I don't do this side first and then I do the other one. No. Okay? If I'm doing both sides of the same tooth, I'm going to do it at the same time. Okay? So let's go. Okay, I'm placing my matrices, both of them. I make sure they're very well adapted, either in the buccal surface and in the lingual surface, as you can see here, okay? They're very well adapted, okay? Even though I'm going to use it, I'm going to do only the left central incisor first, I need to place the matrix on the other tooth also, because I need this matrix here to guarantee the space. Otherwise, when I'm going to inject, when I'm going to do my injection molding, the pressure that composite is going to do inside this matrix here is going to go all the way into the space of the other tooth. You understand that? So I need this matrix here to as a David called it the shepherd matrix. I don't know if he still calls it. He called it the shepherd matrix, just to help the other matrix. Okay. And here in the other tooth, I just placed the matrix, anything over here, just to prevent the conditioning from going to the other tooth. Okay, so I'm using the phosphoric acid inside the matrix. Okay, as you can see there. Okay, and over the incisal edge. Then I'm going to rinse it very strongly. I'm going to dry it out, and then I'm going to rub my universal adhesive inside the matrix, okay? All inside the matrix, from buccal side, from lingual side. I won't polymerize it, and now I'm going to do the injection molding. And now I'm going to put my warmed flowable composite, as you can see here. Again, don't polymerize it, and then I'm going to inject my warmed universal composite. Okay, now I'm just setting up the space properly, removing the excesses. You see, I'm setting up the space properly, removing the excesses, polymerizing it, and then I'm going to remove the matrices, and I'm going to add a little bit of composite in the incisal edge. Okay, so this is one tooth done. I'm going to remove excess with those Softlex discs and some diamond points, as you can see here, very fine diamond points. Okay, I remove the excess, and now I'm going to do the other tooth. As I said before, I'm going to do both sides always at the same time. Okay, so once again, acid conditioning of the whole tooth, rinse, dry, apply the adhesive. You apply the adhesive very thoroughly, as I'm doing here. Evaporate the solvent afterwards. This is a very important step. Okay, and then injection molding. First, the flowable composite, and then the warmed universal composite. Okay. Of course, there will be a lot of excess on the buccal surface and the lingual surface. Okay? There will be a lot of excess. There's no problem. Don't worry about that. Because on the buccal surface and on the lingual surface, it's very easy to remove. We won't have excess on the cervical area inside the interproximal space. Okay? Which is the most important thing. You see? I'm taking a look if everything is okay on the lingual side. So after polymerizing it, I'm removing the matrices. I'm going to add a little bit of composite in the incisal edge. Okay, I could have put the composite all the way, but I don't want the composite on the front surface of that tooth. Okay, I want the composite only on the embrasures and a little bit on the incisal edge. Okay, so see, I'm removing very fast the excess from the lingual. Removing it very fast. Okay, then I use some rubber points to smoothen out that area. I'm going to use all those discs from 3M, and then I'm going to use the those rubber points. Okay, I'm using a felt point like this one here. Okay, a felt point with some polishing paste, and this is the final result. Okay, so I didn't cover the whole surface of the tooth, okay? I didn't cover the whole surface. I just closed the embrasures. That's it. And put a little bit on the incisal edge. But the most important thing here is not what we see here, but what we see when we take an X-ray. Look at how well adapted the composite is in this area here. This is impossible to do with a freehand composite, okay? Look at this small composite here. It's very, very, very well adapted. And you are sure that you used the adhesive in the most proper way, the best way you could use an adhesive inside that matrix, okay, with no contaminants and a very well adapted composite afterwards. So this is the most important feature, in my opinion, when using that that BT matrix. It's, in my opinion, really, it's impossible to do something like that without this specific device, okay? Let me share this with you very quickly, okay? This is a black space that a patient had here, very small one, but she complained also because the size of this tooth was a little bit smaller at the cervical area than the other one. Some people here in Brazil are very picky with those things, okay? And I did, you know, I did a restoration here. I use a microscope. I think I can handle composites pretty well. And look what I did. This is after 5 years. You know, the patient was complaining because when she was flossing, the dental floss was always, you know, getting into the way of there, you know. But look at how it is. You see? This, I did that myself. So now I'm going to remove it. Okay, I'm going to remove it. Thank God, you know, her gingiva is not too infected, too inflamed, I mean. Okay, so I'm removing all the composite, okay? So I'm using everything I can to remove the composite inside that place and without harming the gingiva, okay? So I used scalpel blade number 12 first, okay? Scalpel blade number 12. And now I'm using a fine diamond point, and I'm also using, some diamond strips, some discs, okay, and also a profin. Profin is a handpiece that does a movement of going forth and back, a reciprocating movement of those points. It's a very thin point with a diamond coated, and you can remove some materials from those embrasures, like you see over there, okay? So this is, see how small this is. So I tried to do that freehand, and I didn't do very well. This is very hard to do it freehand. But and you see here that one tooth is very, not very, just a little bit smaller than the other one in this area here between the middle third and the cervical third. You see? So she wanted me to get this a little bit bigger. So now it's easy. Using the BT matrix, you see? It's very easy to do that. So just one matrix, very fast, very easy, okay? So I'm doing all the procedures, the injection molding, I did the acid conditioning, then I put my adhesive, I blew up with air and thin it with air, you know, removed all the solvents, and then I injected the flowable composite, warm flowable composite, and then warm restorative composite, again, the universal A2, remove the excess a little bit, and polymerize. You see, there is some excess in the palatal area, no problem about that. Remove the matrix, and then remove the excesses. Very easy, very easy. And now, after polishing, look at the result. You see? Very well adapted. And here I have the X-ray to prove it. See, the same restoration. Here with the matrix and here free-handed with a mylar stripe. You know, it's impossible to do this without this type of matrix. So I'm not just doing an advertisement here, but I'm telling you about this because I love it. I think it's very important. I think it's something that really helps us in our everyday practice, okay? And it's not only for black spaces like this one here, okay? Sometimes we can use that for class 3. Okay, we can use them for class 3. It's one of the indications. We can use them to close small diastemas like these one here, or even larger diastemas like this one. Okay, and also to do some peg lateral. Bioclear has several other matrices, okay? Several other matrices which are more specific for those situations, for peg laterals, for closing diastemas, but these BT matrices can also be used in these situations, which is also something that we have to count on when we buy those types of materials, okay? So you can use them in several other situations, not just for black triangles, black spaces, okay? So, be careful. First, probe the space before placing the rubber dam. Second, if necessary, you may trim a little bit the matrix in order for you to adapt it more easily into that embrasure, okay? Not at the cervical area, but on the lingual or on the buccal part of the matrix, okay? You can trim it a little bit if necessary, okay? Check the adaptation buccally and lingually. Sometimes you look from the buccal position, you say, oh, it's okay, and you don't check on the lingual surface. And sometimes on the lingual surface, it's not very well adapted, and that's where you need to trim it a little bit. Another thing, be careful when applying the adhesive, okay? This is very important. You must clean the dental surface thoroughly, okay? You can use everything you can, okay? Do the adequate acid conditioning for the right amount of time, from the adequate time, okay? You place it thoroughly. Check if the acid went all the way through the matrix, all the way inside the matrix, okay? Also, apply the adhesive in the entire surface and massaging the dentin, okay? Make sure you place it. Of course, sometimes the space over there is very small. Some people think, oh, I'm going to remove the matrix, put the adhesive, and then place the matrix again. No, don't do that. Because the matrix is pulling away the gingiva, is pulling away the rubber dam. So it's important for you to put the adhesive inside that part, which is all the way down on the cervical area in the embrasure, in the interproximal surface. Okay? So you apply the adhesive inside the matrix, okay, making sure that all that surface in the cervical area you have massaged a little bit over there, okay, with the adhesive. And another thing very important, evaporate the solvents very well. You don't dry the adhesive, actually. What you do with the air is to thin it out and then evaporate all the solvent and remove water that eventually might have inside of there. This is very important, okay? And also, oh, sorry, this is in Portuguese, cuidados. Be careful, same thing. Do not press the matrix into the cervical direction, okay? To avoid bending the matrix. Don't make cervical pressure. You see my finger over there, but I'm not making pressure. I'm just positioning the matrix. Don't press it, okay? Otherwise, it will bend and you have a defect inside the interproximal area, okay? And also, don't press the matrix in the buccolingual direction as well, for the same reason. Use sable brush to remove the cervical excess. And also, you might need different matrices in the same space when necessary. Sometimes you need for the same space. Sometimes you need the yellow in one side and the red in the pink. I mean, in the other side. They say it's pink. I think it's red, but it's pink. I think it's red. But sometimes you need more restorative material in one tooth than the other one. Therefore, sometimes you might need two different sizes of matrices in the same space. Okay, and don't get too obsessed avoiding excess during injection molding. Don't try to remove all the excess. The excess is going to be on the surfaces that are easy to remove. Okay, don't get too obsessed with that, because sometimes if you try to remove too much of the excess, what's going to happen is you're going to have bubbles. You're going to have less material than you should have inside the matrices, inside that area that the matrix is supposed to be very well adapted. Okay, so this is my message for you. I hope it helped you, and see you next time in another Dental Talk Without Secrets. Thank you. Thank you for watching.